Good afternoon, and thanks for joining us, everybody. In the radio room in Regina, we will have Premier Scott Moe and Dr. Shahab, Chief Medical Health Officer for the Saskatchewan Ministry of Health. We will not have any officials joining us over the line today, so it will just be Premier Moe and Dr. Shahab. This is a 2-minute warning. Good afternoon, everybody, and thanks for joining us today. Again, we have Premier Scott Moe and Dr. Shahab in the radio room in Regina. We do not have any officials joining us over the line remotely, so questions will just be directed to Premier Moe or Dr. Shahab. Premier Moe has an opening statement, followed by brief remarks by Dr. Shahab. Then we have about 25 minutes for questions. Premier Moe.
Well, thank you, and good afternoon, everyone. Today is another pretty positive day in terms of our case numbers in Saskatchewan. We have 3 new cases and 18 additional recoveries. This means that over 2/3 of the people who have contracted COVID-19 in Saskatchewan, well, they have now fully recovered. And we now have under 100 known active cases in our province for the first time since March the 26th. As I said on Monday, this shows what we are doing is working. And while there is absolutely no reason for complacency, this is reason for us to have some very cautious optimism as we begin to consider gradually and methodically allowing more Saskatchewan businesses to reopen. It's important to remember that many businesses are already open today in Saskatchewan, and they are operating safely, albeit they are operating differently. Those businesses have all implemented good physical distancing and cleaning procedures to protect not only their employees, but to protect their customers. As other businesses may be allowed to reopen, they will be expected to adopt similar practices. All of the workplace requirements for physical distancing and for cleaning and disinfecting are available on the business section of the Government of Saskatchewan COVID-19 website, and I would encourage everyone to have a look at them. In particular, businesses that are currently closed, you should familiarize yourself with these procedures, as you may be required to implement them if you are able to reopen. I also want to be very clear that there are some restrictions that we will not be relaxing anytime soon. In particular, restrictions that are related to the highest risk activities that occur. We know, for example, that the first wave of COVID-19 cases in Saskatchewan were related to travel, and we will continue to recommend against any unnecessary travel, and we will continue to require that anyone that is returning from another country, including the United States of America, must self-isolate for 2 weeks. The restrictions on large gatherings, those will remain in place. As well, the restrictions on visiting long-term care facilities, which sadly have seen some of the deadliest outbreaks across our nation. So travel, large gatherings, and our seniors' care homes, we know those are 3 very high-risk areas, and we will not be removing those restrictions in the foreseeable future. Finally, I have extended Saskatchewan's state of emergency for an additional 2 weeks. This reinforces that even as we review options for a potential phased-in approach to reopen Saskatchewan, we are still in a state of emergency, and we must not be complacent. We must remain vigilant because, quite frankly, lives in our community and lives in our province depend on it. Dr. Shahab?
Thank you, Premier. So I'll just go over some of the numbers in a bit more detail. Out of the 304 cases, as the Premier said, 205 have recovered. The breakdown of our total cases, 131 in travelers, so that's staying pretty flat. 122 are community contacts plus other exposures, mass gatherings. 30 have no known exposures, so that's the local transmission, and 21 are still under investigation. One thing that we have 8 people currently in hospital receiving inpatient care, no one in intensive care at the present time. One thing I just wanted to highlight in terms of essential services, that includes healthcare, that includes other essential workplaces, and in future other workplaces that start working, is that we have seen occasional transmission in those settings where everyone is very keen to go to work. Those of us, those who are required to work or are at work. But it's really important that for current workplaces that are open, that are essential, and future workplaces, that there should be a clear plan of screening yourself if you're a single-person business, or a plan for all employees to be screened, either self-screening or by the employer, so that you don't want anyone showing up to work if they are sick, because you really want to minimize, even in those workplaces, that horizontal transmission from one person to another. And even there, we want to maintain physical distancing and all the things we practice every day at home or while shopping at those essential workplaces as well, to keep our numbers low, even as current essential workplaces continue and in future other workplaces open up. Thank you.
Thank you, Doctor. We now have about 25 minutes for questions. We'll take our first question from the phone line. Operator?
We have Mark Smith with CTV.
I was just wondering about if the provincial government was aware of the federal stockpile of emergency medical masks and gloves in Regina that was disposed last year and not replenished. Was the province consulted about this?
Up until recently, no, the province has not been aware of the stockpile in Regina or any of the contents of what the federal government had for PPE equipment within the stockpile across the nation. So we're very fortunate, I guess, in the fact that at the current time we feel that we do have adequate personal protection equipment for our healthcare workers. I think the Saskatchewan Health Authority had indicated that we have about a 30-day supply in most every case, and even beyond that in some materials that we need for our healthcare workers. So we are fortunate that our Saskatchewan Health Authority has been very prepared, but no, we were not aware of that stockpile up until just recently.
Do you have a follow-up, Mark?
How is the province working towards getting to that goal of 1,500 tests per day? We've seen lower test numbers over the last few days, haven't hit that 1,000 mark in about 4 or 5 days. How are we working to get to that 1,500?
Yeah, I'll let Dr. Shahab answer to the specifics of where we are on testing and what we are looking at with respect to the actual capacity of our testing. And we have the capacity, my understanding, to go not only to 1,500 but to go beyond that. And we may need that capacity in the weeks and months ahead, and so we want to continue to ensure that we do have that capacity. We have been off the last couple of days, and my understanding is that the requests have actually been down with respect to the requests for tests or the references, referrals, if you will, for those tests. But Dr. Shahab, you may have more to add to that.
Thank you. So we are monitoring, obviously, that both our testing capacity, which currently is very good, and also our testing numbers. And I think there are two sides to this, and we'll continue to analyze and report what we are seeing and how we can maintain adequate testing. So it doesn't always have to be high or low, but it should be appropriate testing. So what we saw, obviously, 4 to 6 weeks ago was a lot of travel into the country, and so there's a large volume of testing that is generated by people who are coming in. And then, of course, as we enhanced our testing guidelines, and flu season was still happening, there were obviously a lot of people with coughs, colds who were getting tested, even if they had not traveled. And we have to remember that, with the second highest testing numbers in the country per capita, our test positivity rate still is around less than 2%. It's between 1 to 2%. So what that shows is that even for people who had not traveled, there's lots of coughs and colds and fevers happening, but very few of those, thankfully, were COVID-19. And so now flu season is waning, so coughs, colds, fevers are becoming less and less common, so that could be one explanation at the present time. Obviously, we want to make sure that anyone who has a fever, cough, cold, tiredness does get tested, so we want to maintain that ability for people to get tested. We don't want the public to get complacent, even if it's, we know that for the vast majority of people, the symptoms are mild, for 80%, but we do want people to take the trouble and get tested, because that really informs our surveillance and our epidemiology and helps us to guide us into what further actions we need to take. And obviously, anyone who's inside a hospital, especially with respiratory symptoms, does get screened, and we want that to continue. Obviously, we want any coughs, colds, and within high-risk populations, for example, long-term care facilities, to get tested. So we need to sustain the testing there. But we'll continue to monitor and report on how the testing numbers continue to perform, both at a provincial level, at a regional level, and also in terms of which risk groups are getting tested. Another group that, for example, got tested in large numbers were healthcare workers, so that's really important. But we also are aware that there are many essential workers who are frontline. There's first responders, fires, police, EMS. There's others who are lay first responders. All of them should seek testing if they have symptoms following an exposure or otherwise. So I think the several categories that we want to make sure that they continue to seek testing where appropriate. Thank you.
We'll take our next question from the floor. Steph?
Yeah. What businesses, or what kind of businesses or which sectors are you looking at lifting restrictions on first?
So we're looking specifically to businesses and services that would be, and recreational activities that would be low risk, if you will, in the early days. So we will come out likely at some point next week with a much more definitive list of what we are looking at, with some time for those businesses to prepare. So I won't get into the details of exactly what we're looking at here today, as we will bring forward that list, providing some time for those sectors to prepare for what would hopefully be an eventual opening. But this is all contingent on, a number of things. We need to continue with strong numbers. We need to ask the people of this province to continue with what I would say has been very effective physical distancing in their community, in the businesses that they visit, at their workplaces. And I think we must also understand that we are not just in one fell swoop in any way going to reopen the economy or reopen a number of businesses. There's been a number of businesses open throughout this, and we have some very strong numbers, and our grocery stores are open. A number of our critical services are open in our communities today, albeit they're operating very differently than they were even just a month or 6 weeks ago. and the expectation when it comes to physical distancing, when it comes to keeping our employees safe, our customers safe, and ultimately our families and the people in our community safe would be the very same expectation in this. So we will come forward with a much more detailed and fulsome plan in the days ahead, but it will be contingent on the people of this province doing exactly what they have been doing over the course of the last number of weeks. What I could rule out is there are some areas where we won't be looking at. For example, and when we mentioned this, I mentioned this at the outset. There are some restrictions that we will not be lifting for some period of time. One would be the travel restrictions that we have in place, as that is a high-risk area. Two would be the number of people that can gather in a setting. We wouldn't be looking at expanding that or not expanding that by very much in the short term. And three, and I think most importantly, is protecting our seniors and our seniors' residents across this province. In fact, we saw earlier this week where we actually strengthened the restrictions around some of the personal protection equipment and some of the standards that we're asking our staff at our seniors complexes to abide by. So that would be some examples where we wouldn't be looking right away, but we'll come forward with a more fulsome list in the days ahead of precisely what we are looking at and how that would be phased in, and some of the parameters that may enhance or delay the phase-in of that.
You have a follow-up, Steph?
When you talk about the mass gatherings, the travel, the long-term care homes, you said you're not going to be looking at those for the foreseeable future. What do you mean by the foreseeable future? And can you specify, are we talking months? Like, especially around the mass gatherings, you know, we have festivals and sporting events. People are kind of hoping that they may see,
Right.
say, in July or August or whatnot. So what do you mean by foreseeable future?
So festivals, you know, sporting events, Grey Cups, for example, that are scheduled to be in this province, and we are, you know, obviously favored, a heavy favorite in that game here with our Saskatchewan Roughriders, and I say that. To have just a minor laugh in a time of, you know, very serious consequences. The mass gatherings that we were looking at were capped at 10 today. If we were to start to expand that, it wouldn't be to the 10 or 15,000 that would allow for those types of sporting events to go on into the foreseeable future, and that would be months. We would look at creeping that up to in a similar fashion as we went down, 10 to maybe 25 to maybe 50. Listen, the COVID is here for a while, you know, for a number of months for sure before we are able to have access to a vaccine. What we are looking to do is to open up some segments of our economy, keep the residents of this province safe, but open up some segments of the economy so that we can have a functioning economy here in the province of Saskatchewan and have a point of where we can actually start to recover economically from. So we're looking in the low-risk areas. You know, large sporting events, festivals, those are not low risk, and so we're not looking at those at this point in time.
Are you saying specifically for Grey Cup at this point, you don't think that's something that Regina, Saskatchewan can be hosting?
No, I won't forecast months into the future. We're trying to actually look days into the future, and what we're trying to do with this phased-in plan is to provide some certainty for business for maybe some weeks into the future, maybe a couple of months. We just can't predict out that far.
We'll take our next question from the phone lines, operator.
We have Murray Mandrick with the Leader Post.
Thank you, Mr. Premier. It's Murray Mandrick. Might you consider reopening the legislature to have legislative scrutiny over special warrant spending, other matters right now? One supposes you could do that through virtual sitting or otherwise, or limited gatherings. But has there been any thoughts in terms of the critical role the legislature plays and whether we might see the same thing happening as we're seeing in Ottawa?
Right, it is a critical role. I haven't had any thoughts to that in the immediate future, but maybe if we're able to get to a point where, you know, where our communities are starting to function to some degree you know, back to some degree of normalcy, and we have some of our economy that has been able to open up again, we might be able to have that conversation. Haven't thought about it to this point. We've been all hands on deck, if you will, managing the crisis that's in front of us and operating, as you say, under emergency orders. And at some point in time, those do need to have a look at and be scrutinized by all of the people of the province, and they most certainly will be. I would say, however, we are going to make every attempt to be as transparent as we can with respect to the province's finances, and so we can look in the days ahead as well. We had brought forward on the last day the legislature sat our investment for the year, our investment forecast for the year. Those obviously have changed a little bit as we are investing further into our economy. We are attempting to assemble some of our best estimates with respect to some of the revenue side of the provincial finances, and when we are able to, we will most certainly bring those forward and release those to the public. Those will change as we go through the days and weeks, but you could look for some type of communication with respect to what's happening on the revenue side of government in the not too distant future and in days, not weeks. And I would just point to the fact that Moody's has released their, has remained us as a AAA credit rating as with their release here this morning. We continue to work through what is a very challenging situation, not only from a health delivery perspective, as this pandemic sweeps around the world, but across Saskatchewan. But we remain in a very solid position also from an economic perspective and well poised to deal with the challenges that we have.
You have a follow-up, Murray?
Yeah, is there a time frame for these major events? And I'm looking at all the things that would normally be on a Saskatchewan calendar each year. Obviously, one of them is the provincial budget to look forward to, but there's so many other things. And to Steph's question on the Grey Cup, a lot of people are wondering if they will at least know when they might be able to plan for that, or when they might be able to plan for a Big Valley Jamboree or anything else. Next week, will we see a sort of a time frame in terms of when the government will at least review some of these issues as to when it can open up and change the rules so that they can go forward with some of these events?
No, we won't see that next week. We're just not at that point yet. What we are trying to do is provide some certainty for some of our businesses, some of our recreational activities, to provide some guidance out into the next number of weeks and maybe a few months with respect to what would be smaller gatherings, if you will, people that might be in businesses in Regina or other communities across the province, and to salvage what we can from an economic perspective. We have not spent a lot of time yet, because we think it's premature, quite frankly, to start thinking about when we would be able to gather in groups of 1,000, 5,000, 10,000, or maybe even 20 or 30,000 people. We most certainly aren't at that point yet today, and I would just say that we most certainly aren't even at a point where we can discuss when that time might be. I don't know if you have anything to add to that, Shahab, but that's just not something we've spent a lot of time discussing yet, because it's quite premature, to be frank.
Yeah, the only thing I would add is that, we've learned a lot over the last 6 to 8 weeks. For example, whenever there were even smaller gatherings, transmission rates can be up to 50%, and that's around food, around handing things back and forth. So we need to be really cautious about not just any gathering larger than 10, but actually what happens at those gatherings. And we've heard from other jurisdictions that when there's a lot of singing, for example, there's a choir group in Washington where there's a high transmission rate in that setting. So, I think that's one area where we need to be very thoughtful. And, of course, who comes to those gatherings? Is it a younger demographic, older? Do they come from within Saskatchewan, within Canada, internationally? So all those considerations and what's happening in the rest of Canada and internationally will have to weigh in those decisions in the medium to long term.
Those are precisely the high-risk events that we just can't consider right now. They would put all of this other work at jeopardy.
We'll take our next question from the line.
We have Guy Quinville with CBC.
Yeah, another question on the testing front. Given that testing requests under our current criteria are down, as you said a few moments ago, and given that we have testing capacity, has any thought been given to proactively testing essential workers in order to find asymptomatic carriers? And I'll pose that to either Mo and or Dr. Shahab. Thank you.
Yeah, that's a really important question, and I think there's several ways of looking at it. First of all, for essential workers that are providing direct patient care, the threshold for testing is extremely low. So, for example, if you're a healthcare worker, even a slight cough, you get tested, because the last thing you want is transmission to happen in that setting. So already the threshold is really low. If there was an outbreak in a closed setting, like a long-term care facility, then consideration may be given to testing even people who are asymptomatic, just to clarify at that point in time who is infectious, who is not, and then you can cohort people within the institutional setting. So there are some, but we have to remember that if you take any individual and follow them over a period of 12 months, if you're not exposed, the testing is of no value. It's a PCR test, and if it's negative, it doesn't tell you anything about yesterday or tomorrow. By yesterday, I mean it doesn't tell you anything about 2 weeks or more before in the past, were you exposed or not, and it doesn't tell you anything about tomorrow. I'm negative today, I may be incubating and may become positive tomorrow, or may get exposed tomorrow and become positive 14 days later. So I think we have to use, even though we have strong testing capacity, we have to use it in a very rational way to inform us about, either cases who need to isolate and their contacts who may develop even mild symptoms, and then in that case, the threshold is really low as well for testing. So that's the comment about the current PCR test. And of course, in future, if there's a serological test that's validated, and because we have to remember there's lots of interest in those testing, but we have to wait for validation, that what does it say, how reliable it is, the interpretation. And that's another area of testing which will inform us who was exposed in the past and may have some immunity. But again, that's still being worked out. What does the testing tell you? Because it's a viral illness. We don't test for immunity from influenza, for example, for common colds. Coronavirus is like a common cold virus. So we have to be very careful in terms of and wait to see the science and the research in terms of what serology in the future may or may not be able to tell us. Thank you.
Do you have a follow-up, Guy?
Thank you. And yes, I do. Sorry, just let me get it in front of me. Timing-wise, where do you think reopening schools would fall within your Reopen Saskatchewan plan?
When we closed our K-12 system, and the universities, our post-secondary system had closed, I believe, even previous to that. But when we closed our K-12 system, we provided the students with their marks. We also provided them with the opportunity to continue with their studies and to continue to have access to their curriculum and to their educator through distance learning, and through ensuring that the educators remained employed during this period, and to provide them with the tools that they need to be able to communicate with their students. And from what I hear, that is going quite well. Not without its challenges, for sure, but is going reasonably well given the circumstances. So we have not discussed whether or not we'd be reopening schools, and I think for all intents and purposes, we would assume that we likely will not be opening schools here in the province. Just it has not been a discussion, and we are looking at ways that we can reopen sectors of our economy, the lowest risk ways possible, and we feel we have a system that, albeit not perfect, is working under the circumstances quite well, and to that I credit the teachers across this province. They're doing an excellent job, and I credit the parents that are working with their children at home through the distance learning modules. It's not a perfect situation, but I think everyone is making the very best of it, and the kids are having access not only to their marks but also to the curriculum that they deserve.
We'll take our next question from the phone line.
We have Lisa Schick with CJME.
I kind of touched on it before, but I was just wondering, Alberta has expanded its testing criteria to anybody with COVID-19 symptoms. Because there seem to be fewer testing done, there's more capacity. Will Saskatchewan expand its testing criteria to that or even further, and when?
So if you look at our self-assessment tool, it is now, irrespective of travel, that if you have any symptom that could suggest COVID, like cough, fever, shortness of breath, you are eligible for testing. But we are going to continue re-examining that. And again, I think we have to strike a fine balance between not over-testing where we expect to find 0 cases just for the sake of testing. But on the other hand, we absolutely want to make sure that testing is distributed geographically, which currently it is, 37 plus testing sites, and the numbers of people who are getting tested is high throughout the province. But we also want to make sure that anyone who has symptoms, suggestive of COVID, it's easy for that person to get tested, irrespective of where they are in Saskatchewan or what their situation is. And we'll continue to monitor that.
You have a follow-up, Lisa?
Yes, Premier, there are some people out there who think it's too soon to even be thinking about recovery, about reopening businesses. What do you say to that?
I think there's some people that think it's too late as well. This is a conversation that's happening in our communities. And to both, I would say this. There are businesses that are open today. And our results, and this is due to the very effective physical distancing measures that people in this province are practicing, what we are doing is working. Our numbers are extremely low here in the province. They're not zero, but they are extremely low. So we are not talking about kicking the economy wide open. We are not talking about going back to doing business as we did before this pandemic hit. What we are talking about is expanding the list of allowable businesses, of which there already are many in our province and our communities, expanding that list to allow other businesses to operate, ensuring that they have all of the supports that they need, and ensuring that they are following the proper and appropriate physical distancing measures, and ensuring that we can not only provide for safe communities and the safety of residents across this province, but so we can provide for the opportunity for our economy to begin to recover.
We'll take our next question from the line.
We have Anna McMillan with Global.
Hey, I just have one question. I'm wondering how often long-term care homes are inspected in Saskatchewan just to ensure that they're abiding by those provincial rules and regulations.
We can get that information. I know there's several agencies who inspect long-term care, for example, for their food preparation and other services, but we can get that detail for you.
Yeah, we'll provide you with an answer for that, Jim, as soon as possible.
Do you have a follow-up at all, Anna?
No, thank you.
Great. And we have time for a last question from the floor.
Mr. Premier, is next week's plan going to say when we expect to peak in terms of our COVID-19 cases? We haven't really gotten that figure out.
Yeah, no, you're right. I won't comment on when we expect to peak, and we've had the modeling here. But what I would comment on is our active cases in particular. Our number of cases per day have been decreasing, and our active cases most certainly have been decreasing, as we're now down under 100 active cases in the province. So I don't know when we will peak, if we will peak, but what I do know is what we are doing is working. And that isn't just in what's closed and what's open here in the province. It's how we are conducting ourselves, how our personal hygiene, we're washing our hands, we're using hand sanitizer. We are not shaking hands anymore. We're allowing distance between us when we visit. We see people visiting across the streets as they're out on walks all of the time. It's not uncommon now. Most certainly was 6 weeks ago. So the physical distancing measures, the restrictions that we have in place that are addressing our high-risk areas, they are working. They are working because the people of this province are adhering to those measures. And so we are trying to inch along, if you will, in allowing some additional businesses to open. But the expectations in those businesses with respect to physical distancing and taking precautions to protect employees and customers will be the very same as the businesses that are currently open today.
Do you have a follow-up, Steph?
I do. Why take the strategy you are with reopening some businesses? Because as we know, cases can surge very quickly. We've seen other countries have to deal with a second wave and then kind of go back into a lockdown, which I would guess can inflict another set of economic disadvantages to businesses that are already reeling from lost revenue. So why take this like touch and go approach if by opening them, you may have to close them a few weeks or months later versus, just waiting a longer period of time with the current lockdown?
Right. So I don't know if anyone knows if just waiting for a longer period of time will get you to where you need to be here as well. Listen, we're planning to avoid that touch and go approach, that spike, if you will, But that's not to say that we won't have outbreaks in regional areas, and that's why any phased expansion, slow and methodical phased expansion of reopening our economy and reopening the economic engine of our province needs to be followed with a number of other things. One is a very robust testing regime. Two is, of which we have the second largest testing numbers in the nation, and the ability and the capacity to go higher. It needs to be followed with a very rigorous contact tracing initiative, of which we have. And so that if there is an outbreak, if you will, in a community or a long-term care home, that we have the capacity to identify it quickly and isolate it just as quickly to ensure that it doesn't spread outside of that area and across the community. So the entire goal of this phased, methodical approach, backed up by appropriate amounts of testing and contact tracing, is to not have those province-wide spikes and to not have those large numbers that would ultimately challenge our healthcare system. And in saying that, we continue to plan on the healthcare delivery side for what would be the most challenging situation. So we feel that we are making the decisions that are in the best interests of Saskatchewan residents, no matter what should happen.
That concludes our time for today. Thanks very much for joining us, everyone.